161. What is the priority nursing action for a patient with a new onset of confusion and hypernatremia? Answer: administer prescribed hypotonic fluids and notify the provider. Rationale: confusion indicates severe hypernatremia greater than 145 milliequivalent/L. Hypotonic fluids correct sodium per clinical electrolyte standards. 162. What should the nurse monitor in a patient receiving losartan for heart failure? Answer: monitor for hypotension and hyperkalemia. Rationale: losartan, an ARB, lowers blood pressure and retains potassium. Monitoring prevents complications, per AHA heart failure guidelines. 163. What is the nurse's first action for a patient with a new onset of pain in a traction device? Answer: assess neurovascular status and notify the provider. Rationale: pain may indicate nerve or vascular compromise. Assessment and notification ensure timely intervention per orthopedic nursing standards. 164. What should the nurse assess in a patient with suspected pulmonary edema? Answer: assess for pink frothy sputum and crackles. Rationale: pulmonary edema causes fluid leakage into alveoli, leading to sputum and crackles. Assessment guides diuretic therapy, per AHA guidelines. 165. What is the priority nursing action for a patient with a calcium level of 11.5 milligrams per deciliter? Answer: encourage fluid intake and administer prescribed diuretics. Rationale: hypercalcemia greater than 10.5 milligrams per deciliter risks renal damage. Hydration and diuretics promote excretion, per clinical electrolyte standards. 166. What should the nurse include in teaching for a patient with a new chest tube? Answer: report sudden chest pain and ensure tubing is free of kinks. Rationale: pain may indicate complications and patent tubing ensures drainage, per American Thoracic Society guidelines. 167. What is the nurse's first action for a patient with a new onset of chest pain in myocarditis? Answer: administer prescribed oxygen and notify the provider. Rationale: chest pain indicates inflammation. Oxygen and notification ensure anti-inflammatory therapy, per AHA guidelines. 168. What should the nurse monitor in a patient receiving glipizide for diabetes? Answer: monitor for hypoglycemia and weight gain. Rationale: glipizide increases insulin, risking low glucose and weight gain. Monitoring ensures safety, per ADA guidelines. 169. What is the priority nursing action for a patient with a new onset of fever in meningitis? Answer: administer prescribed antibiotics and obtain CSF cultures. Rationale: fever indicates infection. Antibiotics and cultures target the pathogen, per IDSA guidelines. 170. What should the nurse teach a patient about preventing infections with a central venous catheter? Answer: keep the site dry and report redness. Rationale: dry sites and reporting symptoms prevent infection, per CDC catheter care guidelines. 171. What is the nurse's first action for a patient with a new onset of shortness of breath post-CABD? Answer: assess respiratory status and notify the provider. Rationale: shortness of breath may indicate pneumothorax or fluid overload. Assessment and notification ensure intervention, per AHA guidelines. 172. What should the nurse assess in a patient with suspected hepatitis? Answer: assess for jaundice and right upper quadrant pain. Rationale: hepatitis causes liver inflammation, leading to jaundice and pain. Assessment guides management, per ASLD guidelines. 173. What is the priority nursing action for a patient with a magnesium level of 1.2 milliequivalent/L? Answer: administer prescribed magnesium sulfate and monitor for arrhythmias. Rationale: hypomagnesemia less than 1.7 milliequivalent/L risks cardiac instability. Magnesium and monitoring prevent complications, per clinical electrolyte standards. 174. What should the nurse include in teaching for a patient with a new below-knee amputation? Answer: wrap the residual limb and monitor for phantom pain. Rationale: wrapping prevents swelling and monitoring addresses pain, per Amputee Coalition guidelines. 175. What is the nurse's first action for a patient with a new onset of chest pain and pneumonia? Answer: administer oxygen and assess vital signs. Rationale: chest pain may indicate hypoxia. Oxygen and assessment guide therapy, per ATS guidelines. 176. What should the nurse monitor in a patient receiving carvedilol for heart failure? Answer: monitor for bradycardia and hypotension. Rationale: carvedilol, a beta blocker, slows heart rate and lowers blood pressure. Monitoring prevents complications, per AHA heart failure guidelines. 177. What is the priority nursing action for a patient with a new onset of fever in osteomyelitis? Answer: obtain bone cultures and administer prescribed antibiotics. Rationale: fever indicates bone infection. Cultures and antibiotics target the pathogen, per IDSA guidelines. 178. What should the nurse assess in a patient with suspected Guillain-Barré syndrome? Answer: assess for ascending weakness and respiratory effort. Rationale: Guillain-Barré causes progressive paralysis, risking respiratory failure. Assessment guides plasmapheresis, per AN guidelines. 179. What is the nurse's first action for a patient with a new onset of pain in a casted arm? Answer: assess for compartment syndrome and notify the provider. Rationale: pain may indicate compartment syndrome, risking tissue damage. Assessment and notification ensure intervention, per orthopedic nursing standards. 180. What should the nurse teach a patient about managing asthma? Answer: use a peak flow meter and avoid triggers. Rationale: peak flow monitoring tracks airway function and trigger avoidance prevents exacerbations, per GINA guidelines. 181. What is the priority nursing action for a patient with a sodium level of 122 milliequivalent/L? Answer: notify the provider and prepare for hypertonic saline. Rationale: severe hyponatremia, less than 120 milliequivalent/L, risk seizures. Hypertonic saline corrects sodium, per clinical electrolyte standards. 182. What should the nurse monitor in a patient receiving imiodoron for ventricular tachycardia? Answer: monitor for pulmonary toxicity and liver function. Rationale: imiodoron causes lung and liver complications. Monitoring prevents toxicity, per AHA guidelines. 183. What is the nurse's first action for a patient with a new onset of shortness of breath in anaphylaxis? Answer: administer prescribed epinephrine and oxygen. Rationale: anaphylaxis causes airway obstruction. Epinephrine and oxygen reverse symptoms, per AAAI guidelines. 184. What should the nurse assess in a patient with suspected ulcerative colitis flare? Answer: assess for bloody diarrhea and fever. Rationale: ulcerative colitis flares cause mucosal inflammation, leading to diarrhea and fever. Assessment guides therapy, per Crohn's and Colitis Foundation guidelines. 185. What is the priority nursing action for a patient with a calcium level of 6.8 milligrams per deciliter? Answer: administer prescribed calcium gluconate and monitor for tetany. Rationale: severe hypocalcemia, less than 8.5 milligrams per deciliter, risks neuromuscular irritability. Calcium and monitoring prevent complications, per clinical electrolyte standards. 186. What should the nurse include in teaching for a patient with a new PEG tube? Answer: check tube placement and report abdominal pain. Rationale: verifying placement prevents complications and pain reporting detects issues, per Aspen Nutrition Guidelines. 187. What is the nurse's first action for a patient with a new onset of chest pain post-angioplasty? Answer: administer prescribed nitroglycerin and notify the provider. Rationale: chest pain may indicate restenosis. Nitroglycerin relieves ischemia and notification ensures evaluation, per AHA guidelines. 188. What should the nurse monitor in a patient receiving furosemide for heart failure? Answer: monitor for hypokalemia and orthostatic hypotension. Rationale: furosemide causes potassium and fluid loss, risking arrhythmias and falls. Monitoring ensures safety, per AHA diuretic guidelines. 189. What is the priority nursing action for a patient with a new onset of fever in cellulitis? Answer: obtain skin cultures and administer prescribed antibiotics. Rationale: fever indicates bacterial infection. Cultures and antibiotics target the pathogen, per IDSA guidelines. 190. What should the nurse teach a patient about preventing hypoglycemia in type 1 diabetes? Answer: carry glucose tablets and monitor blood glucose frequently. Rationale: glucose tablets treat hypoglycemia and frequent monitoring prevents episodes, per ADA guidelines. 191. What is the nurse's first action for a patient with a new onset of seizures and traumatic brain injury? Answer: administer prescribed anticonvulsants and ensure safety. Rationale: seizures risk further brain injury. Anticonvulsants and safety measures prevent harm, per ANS guidelines. 192. What should the nurse assess in a patient with suspected acute respiratory distress syndrome? Answer: assess for severe hypoxemia and bilateral infiltrates. Rationale: ARDS causes diffuse lung damage, leading to hypoxia and infiltrates. Assessment guides ventilation, per American Thoracic Society guidelines. 193. What is the priority nursing action for a patient with a potassium level of 6.8 milliequivalent/L? Answer: administer prescribed K-Exolate and notify the provider. Rationale: severe hyperkalemia, greater than 6.0 milliequivalent/L, risks arrhythmias. K-Exolate reduces potassium, and notification ensures treatment, per AHA electrolyte guidelines. 194. What should the nurse include in teaching for a patient with a new ileostomy? Answer: monitor for dehydration and change the appliance regularly. Rationale: ileostomies increase fluid loss and regular changes prevent leakage, per Wound, Ostomy, and Continence Nurses Society guidelines. 195. What is the nurse's first action for a patient with a new onset of chest pain and pericarditis? Answer: administer prescribed NSAIDs and notify the provider. Rationale: chest pain is inflammatory. NSAIDs reduce inflammation and notification ensures evaluation, per AHA guidelines. 196. What should the nurse monitor in a patient receiving insulin for diabetic ketoacidosis? Answer: monitor for hypoglycemia and potassium levels. Rationale: insulin lowers glucose and shifts potassium, risking hypoglycemia and hypokalemia. Monitoring ensures safety, per ADA guidelines. 197. What is the priority nursing action for a patient with a new onset of fever in septic shock? Answer: administer prescribed antibiotics and fluids. Rationale: fever in septic shock indicates infection. Antibiotics and fluids treat infection and hypovolemia, per Surviving Sepsis campaign guidelines. 198. What should the nurse assess in a patient with suspected rheumatoid arthritis flare? Answer: assess for joint stiffness and swelling. Rationale: rheumatoid arthritis flares cause synovial inflammation, leading to stiffness and swelling. Assessment guides therapy, per ACR guidelines. 199. What is the nurse's first action for a patient with a new onset of shortness of breath and asthma? Answer: administer prescribed albuterol and oxygen. Rationale: shortness of breath indicates bronchoconstriction. Albuterol and oxygen relieve symptoms, per GINA asthma guidelines. 200. What should the nurse teach a patient about managing chronic heart failure? Answer: take prescribed medications and report weight gain. Rationale: medications control symptoms and weight gain indicates fluid retention, per AHA heart failure guidelines.